Hi, this is Dr. Lakshmi from Chest Surgical Center, Chennai. We'll discuss about a condition called Keratosis Obturans, which is deep impacted painful wax in layman's term. Now, why is it important and why should it be discussed? How is it different from the regular wax that you see in normal population? Normal wax that you see in your ear is nothing but cerumen along with the surrounding dust or dirt, bacteria, fallen hair. It's a mixture of all these things. And this particular thing called wax actually helps us clean the ear. Wax, if your ear is actually collecting wax, a little bit of it, that means your ear is healthy. So when you see wax, please don't think your ear is unhealthy. Wax means healthy ear. Now, why should wax be distinguished from keratosis? Keratosis is probably we can call mother of wax. Why? Because it is an impacted form of wax that can cause expansion of the external canal, and this particular condition results in excruciating pain and ear block or hard of hearing in patients. This is mostly seen in young adult females less than 40 years living in tropical climate. The severe pain associated with this condition alone is enough for diagnosis. And along with that, clinically, when you examine, it will be associated most of the time with impacted wax and granulation tissues in the external canal. Now, why should this condition be again important? Clinically, for a clinician, this condition called keratosis obturans has to be distinguished from another similarly presenting condition called external canal cholesteatoma. How is it different? What is external canal cholesteatoma? It is nothing but a bone eroding disease that can cause massive destruction of the bone of the ear. Now, how should it be distinguished? Normally, external canal cholesteatoma and keratosis obturans can present similarly, but symptom wise, patient will have excruciating pain like I told you before in keratosis, whereas in external canal cholesteatoma, the pain may not be so severe. It might be just dull aching pain. Whereas in keratosis, as I said, the pain will be very severe. Also, patient might have foul smelling ear discharge and hearing loss sometimes in external canal cholesteatoma. Radiologically, keratosis almost never causes bone destruction, whereas external canal cholesteatoma always causes destruction of the bone, and it is this destroyed bone or sequestrum that results in bone erosion and foul smelling otorrhea. This is a case of keratosis obturans that we operated. This patient is being operated under local anesthesia with IV sedation because the pain is quite bad. Patients will not tolerate just a plain local anesthesia most of the time. You might have to sedate them a little bit. As you can see right now, like we discussed, there is a granulation right at the entrance of the external aortic canal. These granulations, when they are anterior to the wax, it is better to cauterize them to prevent the field being bloody. Now that I'm retracting the external canal skin, you can see the wax that is impacted inside. Now the granulation tissue is nicely cauterized and it is removed using a curved scissors, micro scissors. Now once that is done, an adrenaline cotton ball is kept there to reduce the bleeding, and slowly using a drum elevator, I'm dissecting the wax outside. You can notice that the entrance and even the canal completely is quite edematous. There's barely any space through which you can navigate your endoscope. So with slowly in piecemeal, you remove that wax completely. With slight leverage using the suction, one can remove the wax completely. Now that the wax is removed completely, we'll have a look inside the canal. Yes, it is the skin is quite damaged. The canal is edematous, and also you can see beyond that entrance you can see a little expansion of the canal as well. Now this canal edema can be reduced by packing a cotton wick with antibiotic and steroid cream, which I generally leave it for 2 days inside the canal, so that once the patient comes back, the canal is quite healthy, and maybe we can continue the pack for maybe 5 days more, and then it will be completely resolved. Now you leave the pack inside for, like I told you, for 2 days, and following which you tell the patient, it is very important to tell the patient that once you get keratosis, there is every chance that you might get it again. So they should be under follow up. At least every 4 to 5 months, they should come and have a look at if at all the wax is collecting inside the canal. Now here is the picture of the same patient, post-operative image, that you can see that it is completely healed and it's quite well. So this is the importance of knowing the difference between wax and keratosis obturans, and why it is important to treat them diligently. Thank you.